The numbness is actually diminished a lot.
Already, and it's
Yeah.
only been a few minutes
That's right.
after your injection.
But the real dramatic effect, I was impressed, was the vision. Look at those trees, the leaves in there.
If he took his glasses
so
off, would he
clear.
even see better? Or? No, okay,
So
yeah.
clear.
But the acuity, huh?
Yeah,
Yeah.
the visual acuity is where it's at.
Wow.
That's
good for
because
people
it's
with
because of
neuralgia.
the cervical nerves, not the cervical nerve, but it's just the proximity of both
Yeah.
the trigeminal and the optic nerve are right next to each other. That's really why, and then the positioning of it.
Yeah, you got the oculomotor, you got ophthalmic on the mesencephalon right below the pons where the V5 is. And
We're
yeah,
also,
it's all,
but at the same
yeah.
time, also within the last couple of months, we've had getting resolution of degenerative. What is that thing called? Yeah, it's degenerative neuralgia.
Even like TMJ,
No, not neuralgia, but what is that thing for the
macular degeneration. Yeah.
macular degeneration, and also
Type 2 diabetics have
and
that.
the
yeah.
diabetic retinopathy
Yeah. Uh-huh.
has been resolving.
Really?
Both my patients that have both those two
Um,
reported.
TMJ2,
Yes, TMJ for sure.
temporomandibular joint syndrome. Even if they have their disc is worn out, huh? Wow.
Yeah, I have a couple of cases that have reported disc repair, and as evidence from the film before and after.
Really? That's
That's
good.
amazing because there's nothing to help macular degeneration.
Oh yeah, there is.
I mean,
There's one.
Now there is this stuff.
yes, but I'm saying other than this,
But
there
remember-
was no options.
The thing that we do the stem cell for is to stem the tide from the use of opioids. due
Of
to
course.
pain.
Yeah.
And that's really the biggest charge is to bring in the stem cells to get rid of having to use the opioids.
Which killed 65,000 Americans last year. Yeah.
And so this is the biggest reason why we should go into this, but not just reducing the pain, but reducing the inflammation and the infection, and also empowering you to have overall wellness. So I mean, those three things are really a trifecta of what we're trying to do: is the pain, inflammation and infection and swelling, and then overall general wellness. And that's what we're looking for.
Well, that's why the FDA director is supporting the stem cell research and use to decrease the opioid epidemic.
Yeah.
So we get a lot of support. So yeah. In fact, Habib, our Invitrix stem cell CEO, got back from a meeting in Washington with Gottlieb, the stem cell director, and how to stay compliant, and he's supporting it right away as long as we're all compliant, which he is. So,
That's
all
what
right.
we-
So
that's
yeah,
what we were talking about in the seminar.
yeah. Hmm.
So we use our stem cell for them because they had some.
I owe him 1 cc of cord blood. All right. Yeah. All right.
Oh, you have to take one.
Well, we brought another type Warren's jelly, but that's better for joints. The blood is better for the nerves. So yeah.
Yeah, I'm just telling you that this is much better for that. The Warren's jelly is great for the joints.
Yeah.
But this is completely different than this one, and that's why. Did you do Warren's jelly on the back?
No, it was the cord blood in his neck, and then the numbness went away, but it came back a few months later.
Correct.
Yeah. So
But you have to apply it much
directly as you did.
directly as here.
Yeah.
Into the.
Oh, there's no question.
Yeah.
And because we did it for his neck, I didn't even know he had trigeminal neuralgia until he
That's
told
right.
me, "Oh, it went away," but because it wasn't direct, it came back. So
Yeah.
this should knock it
In fact,
out.
that was what we are talking
Yeah.
about. We're talking about, hey, I think it's just probably the connection of the nerves, and these in here that actually try to,
Yeah.
give that effect.
I'll
Anyways,
later.
Feelings back.
It's
Well-
actually much less.
Yeah. And the vision's a lot better. It's added bonus, huh?
Yeah.
Right. Yeah.
It'll get better.
By the way.
It'll take about 2 months.
Yeah.
It'll take about 2 months for it to get full resolution. Again, if it's just the degenerative issues, you'll have full resolution of this. What had happened is when you put it in the neck, most of the stem cells went everywhere else.
Yep.
And
Only a
then-
few went
oh,
there.
yeah.
Uh-huh.
But now you have 5 million of it already going there. If you notice also the redness in his head is already gone.
Yeah. Uh huh.
So that redness is already kind of like fading away. And then also the redness on his cheeks has gone away also as well. And so it's very, very, very
It
interesting.
affects the skin.
Yes,
So they
it's gonna
will
make
not
it
think
smooth.
that I'm 78 now.
Yeah, the wrinkles are going to be gone.
You're gonna think you're like, 48.
Yeah.
Yeah.
78 too,
78 years old.
born 1940.
You look good, Kuya.
Yes, you're right. 40.
Right? That looks good.
40.
Yeah, guys, just share the wealth and send some people.
So the health, and wealth and health.
Yeah.
All right.
Huh?
I will remind you about it.
All right. Yeah, so that's pretty remarkable right away. Results are right away.
But the vision is
Yeah.
amazing.
Yeah.
Yeah, it's,
And that lasts.
You know,
Oh yeah.
Wow.
Yeah,
That
it's
is
not-
that is permanent.
Okay.
That vision thing is
it's
permanent.
not
That
just
will help
now.
a lot of people with night vision.
Oh yeah,
Yeah.
for sure.
Issues.
Night vision for
A
sure.
lot of males have it more so than females.
Yeah, night vision issues.
Well, I had LASIK eye surgery like 15 years ago, but at night, yeah, I still the headlights are too bright, so I don't know if that'll help that because I already had the LASIK. So
But
Yeah.
anyways, that's what we're looking at, and you're gonna be good. Kuya.
okay.
Just
good.
take a Benadryl
All right.
if you get a little bit of a little itchiness.
Okay.
But this you're gonna be sore a little bit here because of the injection site for about 2 days. It's just sore.
Okay.
Anything with 22 gauge is not fun.
well, you just went into the inner cheek, not the gum or nothing,
no,
right?
no,
Yeah.
you have to go into that space. You have
Okay.
to go into that space that goes.
The webbing. Yeah.
Yeah, it's in the. I'll have to show it to you.
All right.
It's in the skull. You have to go between the jaw and the cheek. The jaw goes like this, and then the cheek goes like that. You have to kind of go in between the way the jaw opens and then right into the cheek, and by the cheekbone. The facial nerve goes across here, and I think that's what's happening is the facial nerve has been affecting.
Yeah, a
this.
little facial nerve palsy as well.
And mostly from this Kuya is you have like the early signs, the early stages of Bell's palsy, and that's what's happening. And so
Is his lip a little down in his eyebrow?
no, it's just because
He may have, yeah.
no, you're having the first instances of Bell's palsy.
Ah, and we stopped the progression.
And
Yeah.
you basically just got it before it got really, really bad. And so his thing is really not trigeminal neuralgia more than Bell's palsy,
Bell's
because
palsy.
of the facial nerve, and that's what was happening. And so you're probably the first case of a Bell's palsy issue, and so it's
But we got it early. Yeah.
very, very much early, and you should have it much, much faster. And I don't know how often you'll need it, but I think you should try it, and I'll probably have to see you again in another 3 months and see where it goes.
Okay.
But I think it'll hold for 6 months to a year.
Yeah, we'll monitor you. We do all our stem cells. We monitor them at month 1, 3, 6, 12, just to make sure they're making good progress. So, all right. But now we know where to go.
Yeah.
The world's authority on
Okay, just
right.
Somebody might be from
Uh,
Laguna.
no, my family is from Laguna.
Laguna.
Yeah.
Are you from
Louisiana.
Laguna? Louisiana,
Yeah.
Laguna.
Yeah, because
Laguna Beach, right here. No, okay.
from Louisiana. So Dr. Bakuli,
Yeah.
Yeah, we're good friends with Dr. Bakuli.
I'm gonna see him tomorrow.
Really?
Yeah.
Well,
we-
it's coincident,
We're gonna
huh?
go gambling.
Dr. Lendero, yeah.
Yeah.
Yeah, we're gonna go see him.
Yeah, Kalilam. Yeah. It's
Yeah. We
Laguna.
grow up together. Yeah, the wife,
all right. Yeah, Mirna.
Mirna, yeah.
They're my commander and my compadre.
Hey, so next time you get any joint pain, you come over and we'll do your joints. All right? You see how we do it. All right.
I want to go and visit you guys.
Yeah.
And,
In the Philippines?
no, in your
Where- yeah.
facility.
Because we do the stem cells with laser therapy for joints. So
No,
yeah.
I just want to visit your thing, but I'll send you all the joints, and you guys just send me all the head and neck, and
And cranial nerve stuff. Yep, you're the go-to guy. All right.
I appreciate that.
This is how we do it, folks. This is the results we get.
Yeah, you're
And
looking good. You're well, you're starting to smile now, because see, this one was like not turning up because
yeah.
because he was.
Facial nerve palsy. All right.
Kuya, give me about 2 weeks. Okay.
All right, Doc. So we'll monitor your progress. Okay. I'm glad you're making results already.
Yes.
All right. That's great.